We recently had an opportunity to visit Southern California to meet with Dr. Robert Harmon. Dr. Harmon is the co-founder and CEO of VetStem. As a veterinarian and statistician, Dr. Harmon has overseen over 1,000 FDA clinical trials for various therapeutics. We were able to discuss the science, application, and the future of stem cells in horses. So then, the basic question comes out is, how do stem cells work?
So back at the beginning of this last decade, people thought stem cells only worked by turning into a new tissue. So like when we were in veterinary school, they weren't even talking stem cells, but the basic stem cell could help create new tissue.
Right.
Now we know that although they do that, that might not even be the most powerful thing they do. So when stem cells go into an area of inflammation, which they can home to that area, they actually will turn off the overactive inflammation. So for example, in a horse with a really bad chronic arthritis, where it's swollen and painful, these cells actually will turn down the immune system reaction. In essence, a little bit like steroids do, but not with the negative side effects you get with steroids. So they work in several other areas, kind of like an NSAID or an anti-inflammatory drug, but they work in a whole bunch of areas to naturally turn down an overactive immune system and turn that off. They also can rescue dying cells, and as we're probably going to talk towards the end of the discussion about the future, laminitis is an area we have no good treatments, right?
Right.
And the cells die. The foot literally dies. These cells in something like a stroke or an acute injury can actually rescue cells that are dying. So if they can do that, maybe we can help rescue some of that dying tissue. Same thing like in a really bad colic. When you're in there as a surgeon and you're doing a colic surgery and you look at all that tissue you know is going to die.
Right.
Could we use them to help rescue cells? So they turn down inflammation. They can turn into tissue, so they can really make tissue. They can sort of turn off the aberrant immune system. They can rescue cells. And lastly, they're like little paramedics. They run into the injury naturally, or if we put more of them in there, and they call in the rest of the specialist cells to make more new tissue and truly regenerate an injury. So they do all of these things and probably more that we don't know yet.